As we delve into the crucial topic of cancer in the elderly, it's essential to acknowledge a fundamental truth. Age is a significant risk factor for many types of cancer. The likelihood of developing cancer increases substantially as we get older, due to a combination of factors including accumulated DNA damage over a lifetime, weakened immune systems, and hormonal changes. However, this increased risk doesn't have to equate to a bleak outlook. Early detection remains the cornerstone of successful cancer treatment. The sooner cancer is identified, the more treatment options are typically available, and the higher the chances of achieving remission or long-term control of the disease. This underscores the importance of vigilance and proactive healthcare, especially for our senior population. Recognizing potential warning signs and seeking prompt medical attention can make a world of difference. Building on the importance of vigilance, one of the most significant red flags, particularly in the elderly, is unintentional weight loss. We're not talking about shedding a few pounds after starting a new exercise routine. This is about losing a noticeable amount of weight, typically 10 pounds or more, or 5% of body weight, over a period of 6 to 12 months, without any deliberate changes to diet or activity levels. Cancer cells often require a significant amount of energy to grow and multiply, diverting resources from the body's normal functions. This can lead to a decrease in appetite and an increased metabolic rate, resulting in weight loss. While other conditions can also cause unintentional weight loss, it's essential to consult a doctor to rule out cancer or other serious underlying illnesses. Don't dismiss it as just getting old. Another symptom that often gets dismissed as a natural part of aging is fatigue. While it's true that energy levels may fluctuate more as we age, the fatigue associated with cancer is different. It's not just feeling a little tired after a busy day. This is persistent, overwhelming exhaustion that doesn't improve with rest. It's a deep-seated weariness that interferes with daily activities and significantly impacts quality of life. Cancer-related fatigue can be caused by the cancer itself, or by the body's response to it. It can also be a side effect of cancer treatments. The key is to distinguish this debilitating fatigue from the normal tiredness that might come and go. If you or a loved one experiences persistent and unexplained fatigue, it's important to discuss it with a doctor to determine the underlying cause. Let's turn our attention to changes in bowel or bladder habits. While occasional constipation or a bout of diarrhea might not be cause for alarm, persistent changes should be investigated, particularly in older adults. These changes can sometimes indicate cancers of the colon, rectum, bladder, or prostate. Specifically, watch for persistent constipation that doesn't respond to usual remedies or, conversely, ongoing diarrhea. Blood in the stool or urine is always a red flag and requires immediate medical attention. Changes in the frequency or urgency of urination, difficulty urinating, or pain during urination should also be reported to a doctor. It's crucial to remember that these symptoms can also be caused by other conditions, but it's always best to err on the side of caution and seek professional medical advice. Adding to the list of crucial warning signs, unusual bleeding or discharge should never be ignored. Any bleeding that is not related to an obvious injury, or discharge that is abnormal in color, amount, or odor, requires prompt medical investigation. This includes bleeding from the skin, such as sores that bleed easily or don't heal. Bleeding from the mouth, nose, or rectum, even if it seems minor, should be evaluated. Vaginal bleeding after menopause is particularly concerning and needs immediate attention. Similarly, any unusual discharge from the nipples, vagina, or other areas should be reported to a doctor. While there may be benign explanations, it is critical to rule out cancer or other serious conditions as quickly as possible. Another crucial aspect of early detection is being aware of any new lumps or thickening in any area of the body. While not all lumps are cancerous, any new or changing lump should be evaluated by a medical professional. This applies to lumps in the breast, testicles, neck, armpits, groin, or anywhere else. Regular self-exams, where appropriate, can help individuals become familiar with their bodies and detect changes early. For women, this includes regular breast self-exams. For men, testicular self-exams are important. Furthermore, regular professional screenings, such as mammograms and clinical breast exams for women and prostate exams for men are essential for detecting lumps that may not be easily felt. Don't hesitate to seek medical advice if you find anything suspicious. Let's consider persistent cough or hoarseness, a lingering cough that doesn't resolve within a few weeks, especially if accompanied by other symptoms like shortness of breath or chest pain, should raise a red flag. Similarly, a change in voice, such as persistent hoarseness or a raspy tone, should not be ignored. These symptoms can be indicators of lung, throat, or even thyroid cancer, while common colds or respiratory infections can certainly cause coughs and hoarseness. It's important to differentiate between temporary ailments and persistent issues. If a cough or voice change persists for more than a few weeks, or if it worsens over time, it's essential to seek medical attention to determine the underlying cause and rule out any serious conditions. Now, let's discuss skin changes, which can be indicative of skin cancer. Skin cancer is one of the most common types of cancer, and early detection is key to successful treatment. Be vigilant about any suspicious moles, sores that don't heal, or changes in skin pigmentation. Pay attention to the ABCDs of moles: asymmetry, border irregularity, color variation, diameter, larger than 6 millimeters, and evolving, changing in size, shape, or color. Sores that bleed, crust over, and don't heal within a few weeks should also be examined by a dermatologist. Any new or unusual growths or changes in skin texture should be evaluated as well. Regular skin self-exams and annual checkups with a dermatologist are crucial, especially for those with a history of sun exposure or family history of skin cancer. Another symptom to be aware of is difficulty swallowing, also known as dysphagia. Occasional difficulty swallowing, perhaps when eating too quickly, is usually not a cause for concern. However, persistent difficulty swallowing, especially if it worsens over time, can be a sign of esophageal or throat cancer. This difficulty may manifest as a feeling of food getting stuck in the throat, coughing or choking while eating, or pain when swallowing. Some individuals may also experience weight loss due to the discomfort and difficulty in consuming adequate nutrition. If you or a loved one experiences persistent difficulty swallowing, it's important to consult a doctor for evaluation and diagnosis. Early detection and treatment of esophageal and throat cancers can significantly improve outcomes. We now turn to the important topic of persistent pain. Many elderly individuals experience chronic pain due to conditions like arthritis or nerve damage. However, new, unexplained, or worsening pain should not be dismissed, as it can sometimes be a symptom of cancer. The key is to differentiate between established chronic pain and new pain that doesn't have an obvious cause. Cancer can cause pain by pressing on nerves, organs, or bones. Persistent bone pain, back pain, or abdominal pain, especially if it is localized and doesn't respond to typical pain relief measures, should be investigated. Don't assume that all pain is simply part of getting older. Consult a doctor to determine the cause and receive appropriate treatment. Now we need to address neurological changes. While cognitive decline and certain neurological issues can be age-related, new and sudden neurological symptoms should always be evaluated. Headaches that are severe, persistent, and different from usual headaches can be a warning sign. Seizures, especially in individuals without a history of seizures, also require immediate medical attention. Changes in vision, such as blurred vision, double vision, or loss of vision, can also be concerning. These symptoms can potentially indicate a brain tumor, either primary or metastatic cancer that has spread from another part of the body. Prompt diagnosis and treatment are crucial for managing neurological symptoms and improving outcomes. Having discussed various warning signs, it's crucial to emphasize the importance of regular cancer screenings. These screenings are designed to detect cancer early, often before any symptoms develop, when treatment is typically more effective. Age-appropriate screenings vary depending on individual risk factors and guidelines. For women, this includes mammograms for breast cancer screening and Pap tests for cervical cancer screening. Colonoscopies are recommended for both men and women to screen for colorectal cancer. Prostate exams, including PSA blood tests, are often recommended for men to screen for prostate cancer. It's important to discuss your individual screening needs with your Doctor, to determine the most appropriate schedule for you, it's important to acknowledge the potential impact of ageism on healthcare. Sometimes, symptoms in elderly individuals are dismissed as just getting old, leading to delayed diagnosis or treatment. This can have serious consequences, especially when dealing with cancer. We must advocate for proactive healthcare for our senior population. This means actively seeking medical attention when symptoms arise, even if they seem minor. It also means being persistent in communicating concerns to healthcare providers and advocating for thorough evaluations. Challenging ageist assumptions and promoting a culture of respect and attentive care for the elderly are essential for improving cancer outcomes. Family members and caregivers play a vital role in the health and well-being of elderly individuals. They are often the first to notice subtle changes in behavior, physical appearance, or overall health that might indicate a problem. Their observations can be crucial in early cancer detection. Caregivers should be attentive to any of the warning signs we've discussed, such as unintentional weight loss, persistent fatigue, or changes in bowel habits. They should also be proactive in communicating these concerns to healthcare providers and advocating for thorough evaluations. If an elderly loved one is unable to articulate their symptoms effectively, caregivers can help bridge the communication gap and ensure their concerns are heard and addressed. To summarize our discussion of potential warning signs, let's establish clear guidelines on when to seek medical attention. Generally, it's best to err on the side of caution and consult a doctor if you experience any of the following. Unintentional weight loss of 10 pounds or more without trying. Persistent fatigue that interferes with daily activities. Changes in bowel or bladder habits that last for more than a few days. Any unusual bleeding or discharge. A new or changing lump or thickening. A persistent cough or hoarseness. Suspicious skin changes. Persistent difficulty swallowing. New, unexplained pain. Sudden neurological changes. Remember, early detection is key. Don't delay seeking medical attention if you have concerns. If a doctor suspects cancer, several diagnostic tests and procedures may be used to confirm the diagnosis and determine the extent of the disease. These tools help doctors visualize and analyze potentially cancerous tissues and cells. Common diagnostic tools include imaging scans such as X-rays, CT scans, MRIs, and PET scans, which provide detailed images of the inside of the body. Blood tests can help detect certain cancer markers or assess overall health. A biopsy, which involves removing a small tissue sample for examination under a microscope, is often necessary to confirm a cancer diagnosis. The specific tests used will depend on the suspected type and location of the cancer. Once a cancer diagnosis is confirmed, treatment options will be discussed. Common treatment approaches include surgery, chemotherapy, and radiation therapy. Surgery involves the physical removal of the cancerous tumor. Chemotherapy uses drugs to kill cancer cells throughout the body. Radiation therapy uses high-energy rays to target and destroy cancer cells in a specific area. When considering treatment options for elderly patients, it's important to consider age-related factors such as overall health, pre-existing conditions, and potential side effects. Treatment plans should be tailored to the individual's needs and goals, focusing on maximizing quality of life and minimizing complications. Shared decision-making between the patient, their family, and the medical team is essential. Facing a cancer diagnosis can be incredibly challenging, both for the patient and their loved ones. It's essential to remember that you're not alone, and there are numerous coping strategies and support resources available. Support groups can provide a safe space to connect with others who understand what you're going through. Counseling services can offer emotional support and guidance in navigating the challenges of cancer. Organizations like the American Cancer Society and the National Cancer Institute offer a wealth of information and resources. Don't hesitate to reach out for help and support during this difficult time. Remember that addressing the emotional and psychological well-being of elderly cancer patients is just as important as addressing their physical health. Throughout the cancer journey, maintaining quality of life should be a top priority. Especially for elderly individuals, this involves focusing on comfort, independence, and emotional well-being. Pain Management is crucial for ensuring comfort and allowing individuals to participate in daily activities. Maintaining as much independence as possible can boost self-esteem and overall well-being. Addressing emotional needs through counseling, support groups, or other resources can help individuals cope with the stress and anxiety associated with cancer. The goal is to empower elderly cancer patients to live as fully and comfortably as possible regardless of their diagnosis. In conclusion, while age is a significant risk factor for cancer, it's crucial to remember that early detection, proactive healthcare, and comprehensive support can make a profound difference in the lives of elderly individuals facing this disease. By being vigilant about potential warning signs, advocating for regular screenings, challenging ageist assumptions, and providing access to appropriate resources, we can empower our senior population to navigate the cancer journey with dignity and hope. Remember that early detection significantly improves treatment outcomes. Let us work together to ensure that every elderly individual receives the best possible care and support in their fight against cancer.